Do a hip flexor wrap as Ben here has suffered a hip flexor strain. So you said you're a basketball player?
Yeah, I am.
Point guard?
Point guard. Oh yeah, I don't miss.
Point guard, okay. So basically what we're going to do today is I'm going to take this tensor, we're going to apply a wrap around your leg that's going to help bring you into hip flexion.
Okay.
So that we can avoid that painful range so you're able to go back into play, okay?
Beautiful.
Okay, so there's a couple things I'm going to need to get you to do first, and then I'm going to apply this onto you, so I'm going to have to touch around your thigh and then around your waist. Is that
That's fine, that's fine, yeah.
Okay, so the first thing I'm going to get you to do is just kind of hike that shorts up on that injured side.
Okay, perfect.
Okay, so first thing I'm going to do is before we do anything, is I'm going to check for decap ETLS just to make sure that we're not covering anything else that needs to be dealt with on his leg before we apply spray or tape. So have you been taped before?
Yeah, I've been taped
so
many
you're
times.
not allergic to tape,
No,
not
not
allergic to the spray, nothing like that? Okay, so what I'm going to get you to do is you're just going to go into like a lunge stance with that injured leg forward.
Injured leg forward?
Yeah, injured leg forward. We're going to make sure we keep our hips nice and square.
Square hips?
Square hips. And then like a nice lunge, so even a little bit more back. Just so, like as long as it's comfortable, it's kind of an awkward position. You good?
Yep.
Okay. So what I do now is I would apply my spray. I just don't have it. So we'd spray on the area. We're actually going to check before we get wrapping around. I'm just going to make sure that you have PMS present. So I'm going to check just here.
Perfect.
Just make sure you have a cap refill. Can you wiggle your toes for me?
Yep.
And you can feel this?
Yep.
Yeah? Okay. So, you know, just kind of, you kind of relax right now, but while I apply these.
I have terrible balance.
Yeah, that's okay. Alright. We'll give you something to lean on, but our house isn't set up very well. I would have them lean on a table if you were in a clinic, or lean up against a wall if we're in a gym dealing with this. So we're just going to put a couple pieces of tape down. Yeah, so now I just need that good lunge position.
Yep.
Making sure that the hips are square, looking at me. And I'll just keep cueing you if we get a whack a little bit. So we're applying this tape down, which I've now taken on my wrap, just so that we hold the wrap so that it's not going to kind of ride up your leg.
Okay. We
dog ear on the inside, and we come from medial to lateral. Try not to get too far up in the groin. I'm just going to get you to pull your shirt up, just above your hips, where your shorts stay without your hand there.
Yep.
Okay. So ideally he'd be in kind of a compression short, but this will have to do for today. We're going to make sure that we come up above the iliac crest, applying tension when we come up, and then coming back around the body. Ooh, snag. Coming back around the body and back down, again staying out of that groin area. Come up, we're applying tension up, just make sure we keep those hips nice and square forward. Wrapping around, just staying low enough on the groin on the inside that it's not going to irritate. Tension coming up, pulling that hip up into flexion. And we're going to run out right here. So can you just put your hand here and hold this for me? Great. So I'm just going to take some ultralight now. Ideally we'd use 3-inch, but due to a lack of tape right now, 2-inch is fine. So we just kind of follow that same pattern, coming up and around, just to hold that wrap down. And then heat mold on the side. We finish on the outside so that it doesn't rub, causing any issues. I'm just going to check again your PMS. So just checking cap refill. Can you wiggle your toes for me?
Yep.
Good. Can you feel this?
Yeah, I can.
Good. So now we're just going to kind of do some functional testing just to make sure that it's limiting you from going too far back, causing that pain again, okay?
Perfect.
So you said basketball, so can I get you to do some jumps?
Yep.
Bring that leg up. How's that feel?
That feels great,
Pretty
actually.
good?
Yeah, you feel it.
And can I just get you to do kind of a little side shuffle like you do? That's good. That's
Yeah, it
adding
feels great.
support. It's kind of keeping you out of that painful range.
Absolutely.
You feel like you could play in this?
Oh, 100%.
100%?
From
Awesome.
all up.
Okay, that's good.